Hello, I'm Dr. Inman. This is a lecture on respiratory tract infection, upper and lower respiratory tract infections, pneumonia, etc., in domestic animals, including the horse. The concept of bacterial and viral infections in the upper respiratory tract can be really devastating for the animal, essentially, and our approach to treat them is not necessarily to adjust them, although we'll adjust almost all of these animals anyway, which optimizes lymphatic drainage and also blood supply to the various tissues. However, recurrent upper respiratory tract infection in the lung field essentially is best treated with frequencies that we will deliver with the frequency-specific low-level laser therapy. That particular technique involves putting the preset head at the thoracic inlet, dog, cat, and horse, and then we scan the lung field. Remember, this particular laser will penetrate completely through this lung field. We can do it from either side, the top or the bottom. It really doesn't matter, but what we're doing is we're affecting the lung field of the dog, cat, and horse. The animal basically is lasered for about 180 seconds. The frequencies are for infection, which is 784, all kinds of infections, both viral, fungal, and bacterial, but also for lymphatic drainage, 230. Also, the lung field itself has a frequency of 100. We use that frequency, which also doubles as a frequency to increase the arterial supply. Very commonly, we'll use 42 for lymphatic drainage and 4 for venous return, essentially, as a means to get blood in and out of that tissue. And what we're trying to do is we're trying to remind the killer T cells and the body's cellular immunity system to gear themselves up to attack the invading pathological organism, be it virus or be it, in fact, a bacterial or a fungal infection. So our approach is to do this. It's not any more complicated than that. We may do it twice a day for 3 days, once a day for 3 days, twice a week for 2 weeks. And so very commonly these animals would ordinarily have gotten better, usually on antibiotic therapy, which we can use with this or without it, but we find that they get better about 3 times faster. So it's kind of a couple days and the animal's respiratory system is significantly improved, essentially, and also within a period of time they are out of the woods, so to speak. We'll have a tendency to laser them off and on for about 2 to 3 weeks to make sure that the problem is completely handled and we don't have to come back and retreat the animal, essentially. The process is designed to try to get the body to recognize the infectious agent that is non-self and also deleterious, gear up and attack it, get rid of it, and basically rehabilitate the tissue of the lung field so that condition does not opportunistically come back again. This has been a lecture on infection and how we treat infection in the upper respiratory tract in the dog, cat, and the horse. I'd have you go to the website, momtech.com, and invest some time in seeing other things that we're able to treat. About 2,700 different disease conditions we've mapped out successfully and treated them, or had them basically treated by over 800 graduate practitioners in the field using this technology in the last 16 years. This is Dr. Inman. Thank you for watching and have a great day.